The basic structure doctrine is applicable in Kenya. Sichale J.A. dissenting. 2. The basic structure doctrine limits the amendment power set out in Articles 255 to 257 of the Constitution. Okwengu J.A. and Sichale J.A. dissenting. Number 3. The basic structure of the Constitution can only be altered through the primary constituent power, which must include 4 sequential processes, namely civic education, public participation and collection of views, constituent assembly debate, and ultimately a referendum. Okwengu, Katembu, and Sichale JJA dissenting.
All right, welcome back to Daybreak, and of course, that is one, Justice Daniel Musinga, the President of the Court of Appeal. He was reading the final, they called it, there's a word? No, apart from the final orders, there's another one which I'll be finding shortly. But let me introduce the panelists already in studio. Elias Mutuma, an advocate of the High Court. Karibu sana.
Thank you, Sam, for having me.
Gladys Boss from Uasin Gishu. She's the woman representative there.
Yes, thank you.
Karibu sana. I don't know why both of you are all smiles, but you're also expecting one Jeremiah Kioni, the Member of Parliament for Ndarago. He'll be joining us shortly. We were also expecting that would be joined by Edwin Sifuna from the ODM party. He's the Secretary General there. He has sent his apologies this morning. He's not able to join, but the show continues. Let me begin with you, Wakili Mutuma. I mean, your reaction at a time that you've been at it for quite a bit of time, and now ending up with the confirmation of the High Court judgment or the High Court findings confirmed by the Court of Appeal. How is this being received from your side of law?
Thank you very much, Sam. First, let me say happy birthday to our Constitution, because it's turning 12. Is it on Thursday? 27th of August. It's unfortunate that they wanted to kill it before it even got to, you know, teenage. But then a happy birthday to it. So the feeling is good, and not just for me, but for the Kenyan people, because it would have been a dangerous road to walk into if you would have tried to mutilate this Constitution at this early stage without, you know, taking into account the many gains that we have achieved, without a proper audit of the implementation process. Because for us, what we thought was that it is not bad to amend a Constitution, but then when do we amend it? Because we first of all need to do a bit of some stock taking, and we can do that through various forums. So the fact that we were not given a proper chance to interrogate, you know, chapter by chapter, clause by clause, of what is good for us, what is not good for us, then we can have a discussion on whether we really want to amend this Constitution or not. So it's a good feeling and a win for the Kenyan people and a win for this Constitution. Okay,
all right, and Gladys Boss, of course, you've been at it for, again, almost an equivalent period of time since the handshake, the political handshake of March 9th, 2018. What does this mean for you as a parliamentarian, but also as an advocate?
No, I think as an officer of the court, because I'm first an officer of the court before I'm a parliamentarian. I think this has been, it was great just to see that the judges, the analysis of the law that they made was very impressive. For any person who's a student of law, it was a fascinating time that they actually interrogated the Constitution, something that we have not had time to interrogate the Constitution because it's so new. I mean, it's hardly, it's 10 years, how many years? 2010?
11.
Yeah, it's not too much time. And so for a Constitution to become solid, you need the courts to keep on interpreting the Constitution for it to solidify what the law is. So it was good to see the judges go into it, make discussions on it, and then just also discuss certain things that are very important, like the basic structure doctrine. It was good for the judges to pronounce on it, because even as lawyers, we used to toy about it, but we were not sure until the pronouncement is made by the court. Because we are a common law country. Yeah, we live on the common law is based on precedent. So until there's a pronouncement by the court, you cannot say that a certain part of the law is solid until the courts do it. And I think this was good. for us as a country. But it also cleared for us is that when can we change the constitution? The judges agreed you can change the constitution, you can amend it. But what they said, how to amend it is what they settled. And that was very important. Also, we've come from a place in this country where actually the executive has disobeyed the rule of law constantly and every time they had an opportunity. I know that people keep on saying, oh, with the Moi days, you know. But during the Moi days, actually what Moi did was legal. May not have been moral, but it was legal at that time. The problem now is that it is in the law and we still disobeyed the law. So that was settled.
All right, and there's a question I'll be asking later on once Honorable Kioni joins us. But I'm also interested in looking at, it was on the 13th of May 2021, the High Court judges, 5 of them, delivered a judgment. It was one judgment read by all. This time round, we saw the 7 judges presenting what appeared like their own edition or version of the judgment. What is this and why is this practice now?
I think that is the way to go, to develop jurisprudence, and for us, most importantly, to be able to understand what individual judges think. Because the judges of the Court of Appeal and judges of the Supreme Court sit in a bench. In the High Court, the normal practice is that you have one judge sitting and presiding over a case, except for very special circumstances when a bench is constituted. So you're in the Court of Appeal, then you are unable to understand what the mind of a specific judge is because you only look at the judgment, you do not know what specific judge thought about a specific issue. So for the sake of jurisprudence, it is very important for us to hear what each judge has to say about a particular issue. You notice, like for example, on the basic structure, they were almost all in agreement that the basic structure does apply in Kenya. But how do we apply it? Look at Justice Tuyot. He says, yes, I believe that basic structure applies, and I believe it is entrenched in the Constitution under Article 255. So we do not need to go beyond it.
Right.
We just need to look at 255. You go to another judge, and I think that was Justice Kiage, and he says, basic structure applies, but it does not reside in the Constitution. It is outside the Constitution. So that way, I think it becomes important for us then to have that conversation.
All right.
Yeah, I think for the sake of jurisprudence, it is very much important for us to have individual judgments.
And that is one of the areas that lawyers within the Attorney General's office, including Ken Ogeto, have raised discomfort with. He said that there are some parts of the judgment that do not agree with, including that. But first, let me take you to the Jomo Kenyatta International Airport, where I understand the ministry officials are addressing. That is the Principal Secretary in charge of Health, Susan Muchache. Listen on the arrival of Moderna vaccines.
Doses of COVID-19 vaccine. Moderna is the second vaccine to be deployed in this country after we started administering AstraZeneca in March this year. This shipment is the first of the 3.5 million doses of vaccines to Kenya by the US government, which includes what we have received, the 1.76 doses, and another 1.76 doses of Pfizer vaccine, and which are scheduled to be delivered in the middle of next month. On behalf of the Ministry of Health and all Kenyans, I sincerely thank the government of the United States for this kind of donation. Further, I extend our thanks to the governments of the United Kingdom, Denmark, France, and Greece, who have so far donated a cumulative total of 1.130 doses of AstraZeneca vaccine. Ladies and gentlemen, allow me to highlight a few key points regarding our vaccination program. As you recall, the first phase of our vaccine program that ended in June 2021 was hampered by global supply constraints, which were way beyond our control. Despite that, Kenya is making good and steady progress towards achieving its goal of protecting its citizens against the pandemic. So far, 1.6 million Kenyans have received their first dose, and 780,000 Kenyans are now fully vaccinated. We continue to be encouraged by the increasing uptake of the vaccines in the country, because last week alone, we attained a daily vaccination rate of 40,000 people per day. And on Friday, we hit a record of 70,000 vaccinations in a single day, placing us on course to achieving our target of administering 150,000 doses daily before the end of September. Even as we scale up our vaccination program, we remain focused on the objective of ensuring that we protect those who are at the greatest risk of infection. And these are specifically our frontline workers and those with the highest risk of losing their lives. And these are the elderly from this unpredictable pandemic. It is worth noting, ladies and gentlemen, that the case fatality rate has marginally reduced from 2.1% to 2% following our current vaccination efforts and improved case management of COVID-19, including increased availability of oxygen at our facilities. We hope to reduce this further by maintaining the vaccination efforts and ensuring the availability of oxygen in health facilities. Ladies and gentlemen, analysis of our data has shown that 70% of the 4,497 deaths that have been reported so far are occurring in persons over 58 years of age, followed by those who are over 50 years old. It is therefore disheartening to observe that despite prioritizing the vaccinations of persons above 58 years, who are estimated to be 2.6 million, only 91% are fully vaccinated. It is therefore a matter of great urgency that we get 2.3 million people in this category quickly vaccinated to protect their lives. What the analyzed data tells us is that we must continue to prioritize these groups and to vaccinate them quickly as possible, given the high mortality amongst those people that are aged above 50 and at the risk of severe disease and death among adults with underlying medical conditions. I direct the prioritization of these categories for vaccinations with immediate effect and strongly encourage them to ensure that they are fully vaccinated at the earliest opportunity. To reduce community transmission and ensure that Kenyans attain the herd immunity, which will allow us to be able to go about our normal business, we have revised our deployment plan so that we can vaccinate 10 million Kenyans by the end of this year and another 26 million Kenyans by the end of next year. My ministry, working with the county governments, will undertake the following measures to ensure that we attain these targets. And these are as follows. Number one, we shall gradually increase the number of vaccination posts from the current 800 to 3,000 facilities that will be offering vaccination. Secondly, we are mapping out areas with high population densities and shall be conducting our outreach services in these areas as well. Fourthly, we shall go further to set up our communication and community sensitization campaigns. We are also setting up infrastructure that will ensure the deployment of the Pfizer vaccine when it comes, which requires the ultra cold chain storage, which is negative 70 degrees centigrade. I'm glad to announce to you today that with support from JICA, this is the Japanese government, we have received 12 to 70 degrees centigrade freezers with a storage capacity of 3 million doses that we shall be going to unveil within the next few days. In addition, we shall be receiving 15 portable freezers from the UPS Foundation that will be used to transport these vaccines at the required temperatures. So, ladies and gentlemen, we are giving the assurance that as a government, we are prepared and ready to receive the Pfizer vaccine, even with its unique requirements, to ensure that we make it available to be used by the people of this country. Ladies and gentlemen, going further, you are all aware that the Ministry of Health, with the support from the ICT Ministry, has locally developed a digital platform, which is the Chanjo KE. And it supports all aspects of the vaccination program, including pre-registration for the first dose and reservation of the second dose. We have we have embarked on educating Kenyans on the utility of this system. The system has a mobile application module that allows every vaccination center to report to a centralized server. This system allows for pre-registration as well, meaning that you can go ahead and log into the system, choose the vaccination post or vaccination facilities that you opt to get the vaccine, and the date in which you want to be vaccinated, so that when you walk to the facility, they will already have had your data and you'll simply be going ahead to get the vaccination. Our revised deployment plan also takes into consideration the multiple vaccines that we shall be deploying, and we plan to allocate one vaccine type to each vaccination post. So we do not want to have a cross mix of vaccines within facilities. So those that will be designated to offer Pfizer will offer Pfizer. Those that are designated for Moderna will offer Moderna. Those that are designated for AstraZeneca will get them AstraZeneca, so that you are all able to choose which post to be vaccinated at, and you will get your vaccination and that type of vaccination that you're looking for at a specific vaccine post.
All right, Principal Secretary at the Ministry of Health, that is Susan Mochache, reading the statement of the Cabinet Secretary, Mutahi Kagwe, and she's there clearly saying that they are going to raise the number of facilities giving these vaccines from 800 to 3,000, but also with the new vaccines coming in, then facilities will be designated to offer specific vaccines so that there's no cross-mixing of this. And she says that there is an intention to improve the access, especially to persons that are aged 50 years and above. She also says that there has been a donation from the JICA, that is the Japanese government, that has donated freezers with the capacity to store 3 million doses at the temperatures of between 12 to 70 degrees Celsius, but also hoping to receive donations from the U.S. government, from an American firm, UPS, that will be donating 15 freezers, making the capacity to at least store the Pfizer vaccines. And Honorable Boss, as you look at this, of course, there's been several calls that the country needs to boost its capacity when it comes to vaccination. This is another consignment of 880,000, the first one of Moderna. Is this satisfactory, even as you match it against the target of the government to vaccinate at least 10 million by the end of this year?
Yes, I think I listened to her, and okay, there's a bit of loss of facts on what she's saying. She should tell us how many people in Kenya are aged over 50. Then we have the numbers, then tell us this is how we're going to get the batches of of the vaccines. And I'm glad that they are even talking about it now, because I was shocked that the amount of energy we spent on changing the constitution, we should have spent the same energy to try and get the vaccines into the country. That's a bit worrying. And then when they tell us the number of people who have been diagnosed with COVID, they are assuming that all Kenyans go to hospital. Do you know how many Kenyans don't go to hospital? There are Kenyans who can't even show up. They don't even have the money to pay a boda ride to get to the hospital. So people need to understand that. So we are always assuming that every Kenyan can go to hospital and every Kenyan can get tested. But I know that the current tests, to have a test now, it costs between 5,000 and 8,000 shillings.
Right.
So how many Kenyans can afford 8,000 shillings or 5,000 shillings to be tested? They can't even afford to get medical help.
And of course, many challenges that are in the health sector and the health systems of the country. But Advocate Mutuma, how do you assess the performance of the country in as far as vaccinating the people at a time that there's that real urge to get back to normal, that people can continue attending to their lives?
Health is not only a priority, it's also a right, because the government has an obligation to ensure that we attain the highest standard of health in the country. I do not believe that our government does not have the capacity to achieve that obligation. It's only that our priorities are, mixed up. Like we, invest so much in things that really do not, impact on the lives of the common mwananchi. But I give credit where it's due. CS Mutai has tried, because I doubt if it was someone else, whether we would be where we are, it would have been a total mess. So I admire the man, and I know he has done a good job. But then in terms of vaccination, I believe the government has the ability even to buy and distribute the vaccines, because how much, for example, we've not been told, how much does one vaccine cost? I mean, the 2 doses. That is a discussion we should be having, so that we understand the 20 million people who need to be vaccinated urgently, how much would it cost? Is it so hard for Parliament to approve that kind of budget for us to purchase? And I believe with the right resources, we are able to access the vaccines and deliver them to the people.
Right.
Like Mheshimiwa is saying, I know a lot of people who do not have even the luxury of going to a hospital for testing. They just treat it, at home. Others die, no statistics, no one knows about it. Others, you have one member of the family getting tested, and the rest are treated by proxy. Like, I know you tested positive, and since I'm part of the family, I have the symptoms, then let me also treat myself. Others die. So the government cannot tell us that really we are doing well. We are not.
Okay.
They should go back to the people and understand what's going on.
Right, and of course, we know that there had been some money allocated to procurement of vaccines. That consignment that is to be purchased, to that money is yet to arrive, because what we've been receiving lately are donations from the UK and the US. We want to take a short break here, but once we come back, we'll be getting back to the conversation about the Building Bridges Initiative, the Court of Appeal judgment that was delivered on Friday. We'll be looking at the implications of this, especially at a time that IEBC has been found that it did not have the quorum that was necessary to come up with measures on how to do the verification of signatures. What happens to other decisions that have already been enacted and that affect the 2022 election? After the break.